Today, November 15th, 2020, I have to report to Washingtonians, is the most dangerous public health day in over 100 years in our state's great history. It is troublesome, but I must report that we have a pandemic raging across our state, abroad across our state. It is a potentially fatal disease. Left unchecked, it will assuredly result in grossly overburdened hospitals. It will keep people from receiving routine but necessary medical treatment because of the stresses our hospitals will be under. Unchecked, the economic devastation long-term will be continually prolonged. And most importantly, left unchecked, we will see continued untold numbers of deaths. We will not allow these things to happen. Now, we know we've seen previously 2 waves of growth of this pandemic in our state. This is the 3rd wave. And if you look at this shot on your screen, Sam, I believe this is up. Now we're facing a 3rd wave that is trending to be more dangerous than any we have seen before. Inaction here is not an option. We have to take bold, decisive action, and we are doing that today. Average daily cases in our state have doubled just in the last 2 weeks. It cannot go on like this. We have to get this under control, or our medical system will soon be overwhelmed. More people will get sick, sometimes with prolonged problems, and more people will lose their lives. We now have new record daily numbers that have surpassed anything or equal of any time during the pandemic. And as we can see on a chart that I hope Sam will put up, we have seen these numbers go up at a very, very steep rate, as the indicating chart indicates. And the unfortunate thing about this chart is that this will continue to go up at just as steep a rate left unchecked. That's why inaction is not an option here. So all along we have been focused to keeping our hospital system working has been a top concern for us. If the exponential growth of COVID-19 continues unmitigated, anyone who is afflicted with even kind of a need for routine treatment may not be able to get it because the hospitals will be full of people with COVID. So those today, if you were sure you're never going to get COVID, but you might be concerned needing a new hip or a knee or a cardiac operation or cancer, you're at risk if we do not get on top of the COVID pandemic, because we would have to avoid doing some of those other procedures. Yesterday, there were more than 2,286 cases. This is a record for our state. And preliminary numbers from the Department of Health this morning suggest that we will unfortunately break that record again today. I'd like to put this in context of where we are relative to this pandemic. We are today in a more dangerous position than we were in March, when our first stay-at-home order was issued. We are in a more dangerous position due to a combination of the extent of this virus, which is now throughout the state and the nation, and because of the situation we are heading into the winter months. In March, we were heading into the summer months, and we were largely successful relative to other states because of a combination that we acted early, we did not wait. And the one thing about this virus that every epidemiologist and virologist have told us is early action can save the day. We acted early. We also had the benefit we were heading to summer where people could be outside more. But now we're heading inside, and we're heading into the virus's home arena. This is where the virus gets us, inside, where we're heading during the winter. So the time has come to reinstate some of the restrictions on activities statewide to preserve our well-being and to save lives. Now, the choices we were announced today are not easy ones, I can tell you that. But I do believe they are the right choices given the threat that we face. I know it isn't easy. I share your frustration that we are back facing another wave. It would have been wonderful if we could have totally eliminated this. But we know from earlier this year, and I think this should give us confidence, there are things we can do that work. We have done this once or twice before. So we know that if we continue to exercise diligence, that we can continue to knock this down. So today, if I talk about what we will be doing by an executive order today. So accordingly, I'm announcing a series of measures that will give us reasonable hope that the success we enjoyed last spring can be replicated in reducing the horrific rate of transmission, where we were relatively successful compared to other states that did not take early action like we did this spring. As I've said, we know these measures can work. We've showed the country that they can work. So the restrictions we're announcing today, which will be in effect through December 14th, are not as comprehensive or to some degree tough as our stay-home order in March. But every part of our state will see rollbacks in some sense. Most will take effect at midnight Monday. This is not forever. This is only for now. Thanks to the brilliance of our medical community, a vaccine is on the way. We need to hold this pandemic down until the cavalry arrives. This is a temporary situation in our state where we seek a permanent healthy condition. And our goal is to keep the most people alive as possible until the vaccine and other therapeutic measures arrives. And that's a task I believe Washington is up to. So here are some parts of our plan. Indoor social gatherings with people from outside your home are prohibited unless they quarantine for 14 days prior to the social gathering, or quarantine for the 7 days prior to the gathering, and receive a negative COVID-19 test result no more than 48 hours prior to the gathering. This is an important part of our efforts because we know where this virus can get you, and that's in your own home or your friend's home, at a dinner party, at a get-together, at a birthday party, at a Seahawks celebration. Any of those events can end up being deadly. Outdoor gatherings are limited to no more than 5 people. Restaurants and bars are closed for indoor service. Outdoor dining with capacity restrictions and to-go or takeout services are still allowed under this rule. In-store retail, which includes grocery stores, is limited to 25% of occupancy and must close any congregate areas such as food courts in malls. Religious services will be limited to 25% of indoor capacity or 200 people, whichever is less. And choirs, bands, or ensembles are prohibited from performing. Now, I know that in plenty of communities and church services and singing are inextricably linked. And I understand and appreciate how much song can lift our spirits. Solo performances are allowed under this plan, but because of the way the virus travels through our breathing and our singing, it's just too risky indoors for choirs right now. We've already provided a full list of the restrictions to the media and stakeholders, and you'll be able to find those on our website as well. I'd like to talk about what makes these activities risky. The decisions we have made have been based on science, the science of this virus, the science of what conditions lead to its transmission, and the recognition of what works, because we've done these things before, frankly. We can very confidently assume where the risk is based on the science of how this disease spreads. It is most likely to be transmitted indoors, where people are not wearing masks, where they come into relatively close contact and where they spend a good amount of time, such as a restaurant or a gym, or potentially a store, that are unmasked. These are scientific facts. They're indisputable. Anywhere those conditions exist is a risk of transmission, anywhere. And anywhere that we can reduce the number of those conditions that exist is a way to reduce the transmission rate in the state of Washington, in any environment. So I want to address the business impacts. And they are significant, we know this. Look, people have been hurt by previous restrictions. We've seen people laid off because of previous restrictions due to this pandemic during the spring. We've seen some businesses that have not been able to survive. And every single one of those employees and business owners deserve a real feeling of empathy of what they're going through. I feel it right here. These are folks I know. And anybody who's unemployed because of this, even if we can help them, and we intend to do so, that I'll talk about in a minute, it's still terribly traumatic to these families. And we ought to be cognizant of that. And we ought to make decisions that are as unobtrusive to some degree as possible in this regard, and that's what we have done. But we have recognized that what is at stake here, which is life itself. And we're making some hard decisions in that regard. So this is, the COVID pandemic is not just a public health crisis, it is an economic crisis as well. And on how we have fashioned a plan needs to recognize both of those things. We cannot take lightly the impact on businesses in this regard. But this is clear. We also cannot enjoy a full economic recovery, which we all desperately want, without knocking down this virus. That is an economic principle we have to realize as well. So to the business owners and the employees right now, I want you to know you're not alone. You have 7 million people. We're going to look for every way to help you through this difficult time. During the pandemic, my office, in partnership with the legislatures and cities and counties, have distributed $25 million in grants to small businesses, and that has saved thousands of jobs. We've also provided $100 million for rental assistance. And today I'm announcing another effort to reduce the hardship of this pandemic that is brought to business and workers. And I'm committing another $50 million to help mitigate impacts on businesses and workers. And we fully intend to get that money out as soon as possible. This will be in grants, combination of grants and loans, before the end of the year. And we're doing some pretty creative work in being able to do that and leverage some other dollars as well. I'll have more to say about that in the upcoming weeks and days. So we're going to work with our partners to get this aid out as swiftly as we can to folks who have been bitten by this. But we know that is not enough. This is not going to ameliorate all the economic suffering by a long shot. But it's what we've been able to do so far. And I'm going to redouble my efforts, and I hope everybody who's listening to this will redouble your efforts to get the federal government to step up to the plate. We have some big problems because unemployment compensation, which has been so important, will run out fairly shortly. And the Congress has not reinstituted the business support plan yet. It needs to do both those things. Washingtonians, Americans deserve that, and we ought to continue to lift our insistence that they get that job done. But we are also looking at some alternatives if the federal government does not. And I will be talking to legislators about other alternatives to help businesses and help employees if, in fact, the Congress does not act. I want to say that employers who have not yet used the Paycheck Protection Plan forgivable loans, businesses can still apply through the Small Business Administration at their local bank. We are going to regrow our economy. I'm very confident of that, in part because we created the best economy in the state, in the country, before COVID hit us. And I believe we are going to knock down this virus. But we need to act today. Today's announcement does not change our guidance for child care services or for K through 12 education. That guidance and its recommendations will remain in place for now, We know child care is critical, especially for essential and frontline workers, and we know how critical education is for our young folks. So far, the experience with schools in Washington and across the nation show that health and safety measures, when rigorously enforced, can limit COVID transmission in the school environment. At this time, we are not asking districts currently offering in-person instruction to close, unless the local health officer advises them to change course, and the local school board makes that decision, as you know.